righty. Okay, so let's screen share and let us see. Okay. All right. So we are looking at Betty Johnson. Yeah. And let's, sorry, let me just pick up the case notes to remind myself as much as to remind you. Betty, okay. Okay. Hold on. Nope, sorry. This is Betty Johnson. Give me 1 second. Right. Okay, there we go. All right. Okay, so just a reminder, can you guys see the?
Yes.
Yeah, okay. The case notes. So in Arusa, in your own words, if you could remember, summarize for me. Remember, we use the W's: who, what, why, where, when, how. Let me make it a little bigger so it's easier to read. So in your own words, summarize for us who you're writing to, what is going on with this patient, and what are this patient's main issues.
So this is the referral letter to the patient Johnson's GP. From the surgeon. Mr. Johnson underwent a right knee total hip replacement or knee replacement. Sorry, I forgot. Yeah, total knee replacement, right? Total knee replacement because of osteoarthritis. So we are writing the letter to his GP regarding his recovery or his condition. So her, sorry, her. I forgot. Yeah. So in this letter, we will write to her GP about the post-operative recovery, what medications were given, and how is she recovering now.
Okay.
And what the GP needs to do next.
Okay. Were there or are there any complications that require special consideration?
No. No, the surgery or recovery was uneventful. Okay.
Good. And what kinds of things are we asking the reader, the GP?
So we have informed GP that her mobility is good, and we have provided her with crutches and frame and this and that, and we have provided her home care assistance with nurse. So just the GP needs to do is that repeat two tests. I forgot where they are mentioned.
Oh yeah, yeah. FBE,
yeah,
blood exam,
the full blood time,
and INR.
So GP needs to repeat them after 1 week.
Okay. All righty then. So we have a rough idea of what is going on with this patient. So let's now turn to the letter. All right. And I also like to have just a extra page here to the side, just in case we want to make notes as we go. Okay. Come on. Doesn't want to move. There we go. Okay. So when it comes to,
so first thing I want to tell before we start, there are no like extra lines which are showing in this my letter like on the computer.
There are no what?
There are the gaps between the two lines. Like it seems that I have skipped some lines.
Oh, you mean the extra spaces between here? Yeah, don't worry.
Yeah.
Don't worry about that. The important thing is that we can actually see the okay. So who's it? Israel. Haha. Okay. So let's take a look now. So Dr. Tony Jones, private practice, address, we've got the date. Dear Dr. Jones, we've got the dedicated line, we've got the paragraphs, writing on every line within a paragraph, extra space between the paragraphs, and then the appropriate valediction, which is yours sincerely, doctor. Okay, cool. So let's look at the content. I'm writing to inform you of the imminent discharge of your patient, Ms. Johnson. She underwent total knee replacement surgery for osteoarthritis on the 25th of February 2015. That's a lot of twos and a lot of fives. Okay, what do you think of that with respect to the criteria, the purpose? Is it fully expanded, immediately clear what the reader is supposed to do? What do you think? Anyone, Arusa, is there anything that you might change, might add, or you think it's fine? Anything about the grammar, the vocabulary, anything?
We can add one line that your follow-up on her condition would be appreciated.
Yeah, good. Hold on. So you can, let me put in. So you want to add your follow-up, but what about the follow-up? What is he supposed to follow up generally?
Actually, I have written in the bottom paragraph that if you could follow up on Miss Johnson's recovery.
Okay, all right. What about you, Isra? Is there anything you might add now that you look at it?
I would need to add something about the request. So what I wrote that I'm writing to update you on Miss Johnson's condition post her total knee replacement. She has been discharged today from the rehabilitation department and she requires your follow-up.
Okay, all right. So maybe we can put here, oh, okay, I see, I have the wrong letter at the top, never mind. Yeah, I'm writing to inform you of the imminent discharge of your patient, Ms. Johnson. She underwent right total knee, right? So you can just add here, and requires some follow-up by your clinic. Some follow-up by your clinic. Okay, you might say some routine follow-up if you want to, because we already established that there's nothing critical. All right. So just to let them know, because if you say, I'm writing to inform you of the imminent discharge, okay, you've told me the patient is discharged. You know, done.
Yeah, actually, I have written this on my actually, I have written this line on my copy. I don't know why. While typing on the phone, I didn't write it. Yeah. So yeah, this should be mentioned here that your follow-up is required.
Okay, good. But other than that, the vocabulary, the grammar, the structure, fine, no problems there. Okay, so let's move on to the second one. Ms. Johnson's surgery was uneventful. Regarding her post-operative recovery, her hemoglobin was 80 grams per liter. For this reason, an IV transfusion was given, which increased her hemoglobin to 100, and Ferritab was commenced. Her pain was controlled with morphine for 1 day, and then she was shifted to oxycodone as required. She was given Clexane for a week, and her, what is this supposed to be?
I am sure that she didn't understand it, I didn't understand it.
So this is from the case notes?
Yeah.
Hold on, let me see.
It was mentioned at 2 places, ALT clips. I googled it, but I couldn't understand, so I just copied from case note.
Oh, removal of something, dressing.
Yeah, removal of
something.
ALT. ALT clips. I don't know what are they.
What I wrote is that I deleted ALT. I wrote like removal of
Full
the
of
clips.
clips. Yeah. What does RO stand for? I've done this.
Removal of.
remo-
Removal
Ah,
of.
removal of
RO stands for.
dressing. Okay. Removal of dressing. Wound good, which means the wound was in good condition, healthy looking. Removal of something, clips. Just put clips. You're right. Just put clips. Okay. That's
Because
not
it was mentioned that
twice. Yeah. Okay. So remove
there are some types of clips called ALT clips.
maybe. Well, there has to be. There has to be some sort of clips, right? But more important.
Yeah, but
Yeah.
can't we copy just from case notes the ALT clip, because it's written at 2 to 3 places that ALT clips were removed.
And if it's in the case notes and you put it in your letter, it's fine.
Yeah.
So her out clips were removed and her wound is good, even better than is good. And her wound, this is
Healthy.
past, right? This is the past. And her wound, even better, was in good condition. Or you can say, and her wound appeared healthy. That's kind of a little bit more natural sounding. Okay. Because
You know why I wrote, I'm just wrote this in present tense, because even in the today's visit or still the her wound is good. Like it's mentioned again on the next visit that her wound is good.
But that is note form. That's in note form. Remember, the case notes are in note form. It is up to you to put it in nicely structured sentences. Yeah. So wound good is like the most concise. Wound tick. It's like saying tick.
Arusa meant that she wrote is good, like in present, because even in today's visit or in today, it is still good.
Okay. All right.
Like we are writing to the GP, so it's good. Even we say is, then is should be fine. Her wound is still good.
Her wound is, her wound was and remains in good condition.
Yeah, because the whole paragraph is in the past.
Because this date here is technically speaking in the past. Yeah. But as you rightly said, her wound is still healthy. Right. So you can kind of put it in both. The dressing was taken off and her wound was at that time healthy and it remains healthy today. Yeah. Or simply her wound has remained healthy. Yeah. But okay. So other than that though, fine. There are no grammar issues there. No sentence structure issues. No other issues to really kick up a fuss about. Okay. Ms. Johnson was transferred to rehab care on 7th of March. She walks with crutches and mobility is good, and her mobility is good. She's able to do physio exercises and shower with minimal help. She has also been provided with a stick and a walking frame to use when needed. She's being discharged with home nursing assistance, including personal hygiene and home care. Her discharge medications include so you're writing to a GP and you give the exact dosages. Good, because he's a prescribing person who might need to adjust. And paracetamol and oxycodone.
Repeat the prescriptions.
Exactly. Her follow-up appointment will be after 2 weeks. Okay. Anything there now that you're looking at it, Arusa? Anything there that you might tweak or change?
No, nothing in my mind.
I'm asking, I'm not saying that there is, I'm just asking. What about
No,
you?
no, yeah, I know.
What about you, Isra? Do you see anything there that you want to?
I'm just not able to go in because I wrote it a bit differently.
Ah, okay, all right. Different is fine, different is fine. But anything here in this particular letter?
She's able to do physio exercise.
Yeah. Let us.
Physiotherapy.
Yeah.
Yeah, don't make
Yeah.
it shortcut.
Try not to use contractions like can't, don't, physio, labs. Those, yes, in the real world, on the
Yeah.
word, use them for formal writing. Put out laboratory examination, physiotherapy, and so on. Yeah. So she's able to do physiotherapy exercises and shower with minimal help. She has also been provided with a stick and a walking frame to use when needed. Fine. She's being discharged with home nursing assistance.
Not including, yeah, including made it like
Nursing
to help.
with, yeah, or to help with personal hygiene, and home care actually sounds like housekeeping.
Because they wrote it like this.
They put
That's
it
why.
in the case notes, it's like that. Okay. Well, once again, if it's in the case notes, then that's fine. Okay. Nursing assistant, yeah, to help with that. Her discharge medications, very good. No problem there. And her follow-up will be after 2 weeks. It would be appreciated if you could follow up on Ms. Johnson's recovery and kindly repeat her full blood count and INR after 1 week. All right.
Yeah.
So, okay, how would we, and you know what I like to do here, ha ha ha. Okay, so how?
Please be a strict examiner.
Please. Okay, let me hold on 1 second. Let me clear off this. I put somebody's, I changed this by accident. All right, give me 1 second. Let me just prep this transcript. And right. But you just got a glimpse of somebody who actually did get an A. I was struggling hard to find something wrong with that letter. Okay.
We can't see your screen if there's something
Hold
in
on.
your screen.
Right, there we go. Can you still see the screen with the letter and the transcript?
Yes.
Okay, good. All right, so let's now grade this letter. Purpose, is the purpose fully expanded and immediately clear?
Yes, after the addition of the last sentence, yeah.
Yeah, but without the addition, oopsie, without the addition of that sentence. But again, it's not like a major life-changing event. Hold on. We've got things here that do not belong. So I would say, just because of that, honestly, I'd take off half a mark, but that's just me. Okay. Content. Is all the important information in there, and is it accurate?
It is accurate.
Yes, it is. And all the information is there that the doctor will need. So I would actually give full marks for this. Okay.
I thought you said I will give 4 marks for this.
4 marks, no, full marks, full marks, full
Okay.
marks. The good thing is, what I also like about this letter, 2 things is, the writer realized that you don't have to give any social background because you're writing to the patient's GP. So you can leave out that. And that they didn't go back. They started right. Okay. Post-op.
Past medical history and this and that.
Yeah.
Because there were a lot mentioned, like he had an atrial fibrillation, something heart condition and this and that. So nothing to mention.
Okay. So all of that was left out. So, which brings us conciseness, clarity, and leaving out all relevant information. Actually, quite good. All right. Genre and style, yes.
Yes.
Yeah, definitely. Polite form, correct level of technical info. It remains factual, and any abbreviations, even if we don't know them, the reader could be reasonably expected to know them. 7. Okay. Organization and layout. Yeah, I don't have any problems. Yeah, I don't have any problems with layout. It's logical. The paragraphs are grouped together.
Prioritized.
Yeah. And you can get a quick overview of where to find certain information, because that tells you why you're writing. That says, okay, what happened immediately after surgery. This tells you what happened after rehab, and that is what is needed in her follow-up. So yeah, I don't have a problem with that. Language,
There is some problem like
yeah,
grammatical mistakes and
just a few little bits and bobs, nothing major. So I'd give 6 or 6.5.
my God, this is not possible.
Yeah. Wait, how many
I
words
wish
is this? How?
I can't. It was, I think, less than 200. Let me.
No, it's 237. Okay.
Because the things that you are adding and
That I'm
deleting.
added, yeah.
Yeah.
But here's the thing, again, yes, this is 230 words plus, and technically they say 180 to 200 words, but again, the examiners do not count words. And this letter flows so smoothly, they're not going to deduct huge marks just because. Right?
Can I give like a point, like my opinion?
Yeah, yeah.
So sorry, Isra, sorry to interrupt you. So when I sent you the letter, it was 220 words. So after, editing and writing extra words, so.
Yeah. So what I would say is like, I feel there are some extra information. For example, he doesn't need to know like about he doesn't like in the first paragraph, he doesn't need to know all of these things. Sorry, not the purpose, the other one.
This one?
Yeah.
Yeah.
That his hemoglobin increased from that to that, and we give her that. She used morphine, then we transferred her onto those things, because he is not like going to do thing. I mean, if it was me and I saw like the word count went after like beyond 200, I would delete this information, because it's most probably like not relevant to the GP. What would he do with that?
I thought this too, but then I thought that GP must know that what medication were given post-operatively, because we are informing the GP regarding her post. But maybe, yeah, you are right. We can skip this if the word count is exceeding.
But there's an argument for putting in the fact that she had a transfusion, because look, that is one of the things they're looking to follow upon. So you can do it both ways. You could be a little bit more concise about this. Surgery was uneventful. Her hemoglobin was that. So maybe
I think we can skip this line. So her hemoglobin was 8. We should mention blood transfusion. So IVT transfusion was given. Then we can cut this line, which increased her hemoglobin level to 100 and ferrotab was commenced, because we are already mentioning in the last paragraph about discharge medication, ferrotab is mentioned. So we can decrease the word count by cutting this line.
Yeah.
So it's just a matter for me, when I finish writing and I see excessive words, I just go to see like, okay, what can I delete?
What you can.
Okay, yeah, you're right. Yeah. Okay.
But okay, so there's an argument for the fact that, okay, it's over 200 words, but once again, If you go 2030 over 200, OET is not going to suddenly slash just because it's too many words. And in truth, barring those little bits that you left out to kind of, for the sake of cohesion, pull it together, this letter actually reads very smoothly.
Yeah.
So if the examiner is running their eyes over it and it's running smoothly, you know, they might forgive the odd 10 words are here. But yes, if you want to be strictly, because you guys are going for your 400, if you want to be absolutely strict, you could, yes, make this a little bit more concise. Ms. Johnson's post-operative surgery and post-op period were uneventful, except for an IV transfusion to raise her hemoglobin to 10. You know, she was commenced on Faratabs, which she continues still, and is currently on whatever. So yeah, if you want to make this, and was placed on analgesia, routine analgesia, and anticoagulants. So in other words, you can say routine analgesia, routine anticoagulants, and a transfusion to raise her blood to her HB to 10. Yeah.
Yeah.
And her wound post-operatively was healthy and remains so. So yeah, if you put it like that, it will probably cut this paragraph down to,
Yeah.
you know, half of its length, or maybe 2/3 of its length. But it's not a disaster, it's not by a long stretch. Okay. More importantly, actually, is I would say are these little points here that kind of pull everything together neatly. Yeah. Okay. So this one, ooh, look at that. So this person gets 36.5. Yeah, this is a 450, right? And if the examiner decides to be super duper mean, they may pull it down to a 420, 430.
They can pull it down till 400.
Yeah.
They
Or even
can
down
pull
to
it
400.
down to 400.
Yeah, but this is a good letter. This is a good.
Can we go through mine? Like we
And do
still have
yours?
15 minutes. Yeah.
Yeah.
I have a training
Oh, right.
at
Yeah,
10.
you gotta go. Okay. Okay. Save. All right. So let us now go to
From what like we discussed, I noticed that I missed one relevant information, which is the blood transfusion.
yeah. Because okay, so this is Israel's here.
It's just because of the follow-up investigation that why he needs full blood count.
Yeah. Okay. So let's look at this one now. So again, formatted as it's supposed to be. Addressee here, date, dear Dr. Jones, the rail line, correct paragraphing, formatting, and then correct valediction. So.
Can I ask one thing? Can we write age like this? So if we are writing 81, isn't it year only without S? Or this is fine, I'm just asking.
Age 82. Actually, hold on. Let me.
Because if you write with these,
let me show you let me show you the either or. And the either or goes like this. Age without what you see this is the format for an adjective. So you would say an 81-year-old woman with the hyphen.
Yeah. Okay.
Right. So you say either thank you for this is just an example for seeing this 81-year-old okay, woman or lady, because this here serves now as an adjective. Okay. Whereas if you say, what's her name? Betty Johnson, age 81 years old, years here is a noun. Yeah.
Mhm.
So
Okay,
it's
still we can put with hyphen like.
what, 81 years old?
Yeah.
You don't
I got
usually. You don't usually.
Yeah.
It's either this,
Yeah.
81-year-old lady, 81-year-old being used as,
Yeah.
oops, adjective, or she is 80, because it's effectively saying she is 81 years old, and years there is a noun.
Okay, got it.
All
Yeah.
right,
Yeah. Then
right. So this here
so
should
there shouldn't be these. Yeah.
be 81 years old. Okay.
Oh, yeah.
I'm writing to update you on Mrs. Johnson's condition post her total knee replacement. She's been discharged today from the oh, it's just a T missing. That's a typo. Rehabilitation department, and she requires your follow-up.
I had that T in every word of rehabilitation, and then I said, no, this T does not come here. I deleted it.
You purposely took out the T, but then it is rehabilitation.
Yeah, yeah, yeah.
Okay. Ms. Johnson was, and oh yeah, you keep getting transposing of letters. You have the E,
Yeah.
you have SSE instead of ESS. Ms.
Mm.
Johnson was successfully operated on. Here's the joke. Here's
Oh.
why.
On.
Yeah. Because you operate
Oh yeah,
on
operated
something,
on. Yeah.
and then it's on a date. So it's
Yeah.
actually two on. It actually is an on, which is weird, which is why we say she had her she underwent successful surgery on. Because the
Yeah.
on looks, it's grammatically correct, huh? But it just
Yeah.
looks weird. You know, it's just one of those. Okay.
Mm.
So an alternative to that is mhm. Yeah, she underwent successful total knee replacement surgery on, and then the date.
Yes.
It just simplifies it, but yeah.
Yeah.
She was operated on. English is so stupid, huh?
Okay.
And she showed progressive recovery from
Surgery E. Yeah, I knew it. But you know what I am doing? I don't have the red line in my board, so like I make mistakes.
You took out, you took out. No, but that's a good way to improve your spelling. You took out the
Yeah,
spelling that
exactly.
forcing
Yeah.
you. Yeah. Her warfaring was restarted on the following day, and all the clips were removed. Good, fine. And she showed progressive. After her clip.
Can I say in the previous paragraph? So
Mhm,
she mentioned that she showed progressive recovery from the surgery.
mhm.
Then straight away after this, her warfarin was restarted on the following day. But again, I would say I don't know about the word count, because if he is already on warfarin, so it's the protocol of the surgery that warfarin is restarted on the same day. So is it necessary to mention?
Say that again.
Like he is already on the warfarin because of his heart condition. So GP must know that he is on warfarin.
Mhm.
And usually for the surgery, we skip the morning dose of the warfarin and then we start on the following day. So obviously, I think it's, yeah, we can mention if we have word count. I'm just saying.
No,
that-
what I mentioned it is that like there is no bleeding ongoing, so we could restart his warfarin. That's what I meant.
Yeah,
Oh,
okay.
okay.
But
So we have both options. Like we can omit,
Mhm.
or if we add, then it's totally fine. I'm just saying, yeah.
Yeah, okay. So after her, here's the thing. If you're going to say
Yeah.
clip removal,
Then yeah.
Okay.
um, after her clip removal, Ms. Johnson, or have it as two separate words, but not the plural. That's probably why the blue was under there. After her clip removal, because here clip is, yeah, I know you got to go soon. Clip is serving as an adjective describing removal. So and adjectives are in single form, not plural. Yeah. So after her clip removal, Ms. Johnson was transferred to rehabilitation. Yeah, you are serious about not liking that T, isn't it? She was gradually increasing her independency during her stay until she was able to take a shower with minimal. The second S is, oh, sorry, undo. It is ASSIS. Hold on. ASSISTANCE. So only one.
Okay. One S. Yeah.
Good. And here, she was gradually, she gradually increased during her stay. So for us, during her stay is a definitive time. Yeah. So increased. She gradually increased her independence. Yeah. During her stay until she was able to take a shower with minimal assistance. Yeah, just watch it. Her wound was healing well, and she performed is actually a word. You mean perform. Well, because this is a verb, so you need the adverb.
Yeah, adverb.
Yeah.
Okay.
Whereas good is adjective describing a noun. Yeah. Performed well in her physiotherapy exercises. Today, Ms. Johnson has been discharged with home nursing to assist her in personal hygiene and home care. Her wound is exposed and she uses a stick or frame when required.
Or a frame. A frame.
A stick or frame. Well, you could put the extra A there if you want, but you don't have to. When you put a stick or frame, it kind of implies that the A also goes in front there.
Do we need to mention crutches as well, or there is like no need to mention?
Using them anymore.
No, she's not using it anymore. You can go straight to the stick.
No, I'm asking about the previous paragraph.
She was healing.
Like she started her.
Because it's done and dusted. She's on now to where she is now. Yeah.
Yeah.
Her wound is exposed and she uses a stick or frame when required to support her mobility. She's currently on warfarin, Ferritab, paracetamol, oxycodone, and you gave the doses. Good. Ms. Johnson has a rehabilitation appointment in 2 weeks' time, and she'll require assessment of her after 1 week. If you require more information, please don't hesitate to contact me. Yours sincerely.
Please,
Just
an appreciation only for hesitate.
Please do not what?
An appreciation for hesitate, because I wrote it correctly this time.
Oh, that's true. That's true. That's one of the words that you always get wrong, like me and maneuver and bureaucracy. Yeah, you got it right. So the only thing when it comes to
only thing we need is that she needed IV transfusion because of low hemoglobin.
Surgery. So what you can do is actually wrap it up in here with the exception of a transfusion to raise her HB to
100, 10 or 100, yeah.
Per what is it, liter? No, 10 grams per deciliter, or whatever. What is the whatever unit they use in the notes? Yeah,
10, I think. Yeah.
Yeah. Okay.
Yeah.
So that is, that's an omission there, because you are asking them to do a full blood count afterwards. But other than that, it is spelling. Okay, so I would say Isra.
Isra used to tell me that like she has the problem with spelling. It proved today that yes, you have a problem with spelling mistake.
I haven't written a letter for a long time.
Oh,
So that's
yeah.
what I told you, like Mrs. Banfield, she remembers what I told her. If I don't write consistently every day,
Yeah.
this is what would happen to my writing.
Yeah.
This is understandable.
So what you need to do is for the next couple of letters you write, take them and do what you do, put them in Grammarly and type out the correction. And then after that, do it twice to kind of get into your brain what the correct writing is. And then you can go back to not using it. But every now and again, yeah, use it to help your spelling. All righty. Okay. So this one, unfortunately for this one, of course, you would lose some marks for
Grammar.
grammar.
Spellings.
So for grammar and spelling, we're coming down to the wire here. I'm trying to rush and finish on time for once today. Okay, so let's work from the bottom up then. So for your grammar, for your spelling, your punctuation is fine. So here it is spelling that's an issue.
Grammar, I had one grammar issue as
Yeah,
well.
here with some grammar, clip removal,
And
yeah,
gradually
performed well, and your articles. So grammar is also an issue there. So for this, I would give you a maybe like a 5.5. Let's say 5. But organization and layout,
It was very good. Yeah.
it is prioritized. You do use the correct level of technical language. Sorry. It does remain factual, and any abbreviations you use, yeah, are abbreviations that they'll be expected to know. So for organization and layout, I will actually give you a good mark. Genre and style, again, I also would give you a good mark.
Yeah.
But the thing about it is your spelling issues kind of impacted your clarity. Yeah. Although you did have a nice concise letter, so I'd give you a 5 there. And because you left out a couple of things, yeah, I would also
Just one thing. I think she left just one.
with the
One thing.
translation, right? Yeah. Okay.
Yeah.
So all relevant information. And the content, all the important information, all right. And then purpose, yeah.
3.
You get the marks for purpose. Okay, so what we have there is 13 and 14 is, what is that, 27?
32.
32, okay. So 32 out of 38 is still pretty good. Let me do my math and see. Hold on. Yeah. This, if the examiner really wants it to be persnickety, they could say 390.
I would say
Or
this is
380.
70, yeah.
Yeah,
From what
380, 370.
From what I usually write, yeah.
You are strict examiner anyways. All examiner will be good. Don't worry.
Yeah. But it's simply because, again, of that little left out. It's like minor things that you can fix. This is stuff you can fix overnight. This isn't anything, that you need to do a whole bunch to correct. All right.
Yeah.
So if they were super duper generous, you could get your 400, 410, but likely, honestly, this will be a 380 or so. But again, you just need a little bit of practice to get you back on stream and you'll be good to go. All right.
It's just because of a
mistake.
Pardon? What?
Oh yeah, 2 days,
Wait
1
for
day
the
left.
results. Wait for the results and then decide if I need to practice or not.
Or not. There you go. That is a nice, calm way of dealing with it. All right, guys. So that's
should I stay here?
Yeah.
You should stop the recording.
Yeah, I should. Okay.